my talk on clinical trials in REM sleep behavior disorder really had a goal of illustrating how easy and challenging is to talk about clinical trials in this space, but also how challenging and exciting is to talk about this. And when I talk about the former, I mean, it's easy and challenging because we have not had many clinical trials in this space. And it's challenging and exciting because we will probably see a revolution when it comes to the clinical trials in this space that will focus on disease modification that is relevant for REM sleep behavior disorder and some neurodegenerative diseases that this disorder actually represents a prodrome of. Whenever we speak about clinical trials, I would say in REM behavior disorder specifically, we need to think about symptomatic clinical trials and clinical trials that will center on disease modification of these neurodegenerative diseases. And for this second group, we haven't had any. As of now, we are really in phases where we are doing clinical trial readiness for this type of clinical trials that are about to come in a few years for sure, I would predict. And when we talk about symptomatic clinical trials, those are trials that are focused on symptom control in the space of REM sleep behavior disorder, i.e. symptomatic treatment. Over the past several years, we have seen several clinical trials in this space that have used mainly melatonin and its various preparations and benzodiazepines, specifically clonazepam. These two classes of drugs have been traditionally mainstream of treatment for REM sleep behavior disorder. And over the past few years, we have seen organized, randomized clinical trials, which we were lacking in the past, as all evidence for the effectiveness of these medications was based on expert opinion, our clinical experience in small case series. So this is really what my talk was about at the World Sleep Congress.